First up tonight, medical practitioners who are allowed to operate anywhere in Australia without qualifications. They're acupuncturists, practitioners of a form of Chinese medicine which is almost as old as China itself. It's still regarded with more than a degree of scepticism by the organisation which regulates Australia's health services. They say there's no scientific proof that it works, yet there are no controls on acupuncture. Anyone can hang out a shingle and offer the treatment. So where does that leave patients? Martin King reports.
Well, the first needle that I'll insert will be over the spine here.
What's this lady suffering?
In case of this point, it's used for tension headaches, neck pain, shoulder pain.
It might not be how your local doctor treats a headache, but acupuncture is now widely accepted as legitimate medical treatment.
This point must be needled with great care.
And what happens if you push that needle in too far?
Okay, well these are going in between the vertebra, and so therefore there are some points all along the spine here, particularly some up closer to the head here, that if they go in too far they can actually damage the spinal cord itself.
Kerry Watson spent years studying before he qualified as an acupuncturist, but he won't vouch for about 1,500 so-called acupuncturists who practice throughout Australia.
At the moment, anybody can set up an acupuncture practice. They need to get their clinic approved, but the level of qualifications is not considered, and we believe that's a very dangerous situation to continue any longer.
Now, that's a very real concern for public health, and it's also a concern for those reputable persons who practice acupuncture based on a fairly extensive other health professional education program.
Hugh Batten is the Dean of La Trobe University's School of Health Sciences.
A member of the public going to a practicing acupuncturist should be assured that the person is qualified and a competent clinician.
A minor miscalculation, a slip of a needle, and the results can be life-threatening. According to the National Health and Medical Research Council, there's always a risk of injury, especially when the patient is in the hands of a quack.
It's a very big worry. I think we've been very fortunate that not as many accidents have happened as could have. But I think it's important to prevent those accidents before they do.
But accidents do happen. In 1980, an unqualified Melbourne acupuncturist, Anna Vukadinovic, was called a quack by the coroner inquiring into the death of one of her patients.
Her behaviour at the time of the patient's death was immoral. She knew the patient had died, yet she let the patient's daughter take her home and told her to let her sleep for 2 days.
It's obvious that some educational standard or registration is in the best interests of the patients, and that's what the National Health and Medical Research Council decided in May last year.
They had evidence and quoted the references of a number of cases worldwide where acupuncture has caused danger and has caused injury to patients. The minutes of the meeting clearly supported registration and made very clear statements about who they felt was safe or who they felt was unsafe out practicing acupuncture.
The Working Party is particularly concerned about safety. 3 to 4 year courses conducted by the acupuncture colleges have the potential to provide training for safe practice.
But 6 months later, when the final report was made public, those issues, which you'd think were crucial, never made it into print. And for reasons best known to them, they won't discuss it.
It's unfortunate that that report does lack clarity in a direction which government might develop as policy as regards an education program.
Why they withheld that information from the public, we do not know, but we feel it's a very inappropriate thing to have done.
The committee was made up of Western-trained medical practitioners and did not support the registration of acupuncture. It even questioned the very worth of acupuncture, claiming it wasn't scientifically proven, but also pointed out that registered Western-trained doctors practiced safe acupuncture.
Like everyone else, I wonder who's sort of influenced the Working Party to withdraw or withhold that information from their report.
Now, the frustration at the moment is that we neither have an approved education program in mainstream tertiary education, nor do we have registration of these persons, which does place the public at some risk.
And remember Anna Vukadinovic, the unqualified acupuncturist who was described by the coroner as a quack? Well, she won't speak with us, but she's still practicing here in her home in the Melbourne suburb of Bentley, the same place where the tragedy happened.
By the National Health and Medical Research Council not advising the Australian public how to make safe choices or choices for safe acupuncture practice, they've in a sense, allowed people who are not properly qualified to set up shop as an acupuncturist.
Registration of health professionals applies in other health fields. Physiotherapists are registered, nurses are registered, medical practitioners are registered.
I think it's an absolute recipe for disaster.
Martin King reporting. It seems the federal government was also unimpressed with the Working Committee's report and has now called on the committee to address both the issue of qualifications and regulation for acupuncturists. Next, the school that's banned the Ninja Turtle craze.